Do you experience fatigue, muscle soreness, or have trouble tolerating the cold? If so, you could be seeing symptoms of hypothyroidism. According to the American Thyroid Association, hypothyroidism is a condition where the thyroid gland does not produce enough thyroid hormone for the body to function normally. This deficiency, as stated by the Patient Education Center, affects the way in which the body uses energy. As a result, many of the body's functions slow down. A list of compiled symptoms of hypothyroidism can be found on the Endocrine Web website in an article written by an expert on parathyroid disease named James Norman. The symptoms vary and can include weight gain, puffy face, constipation, dry skin, dry, thinning hair, decreased sweating, heavy or irregular menstrual periods, fertility problems, and depression. Many of these symptoms are fairly normal and would not cause someone to ask their doctor to be tested for hypothyroidism, but if left unaddressed, it could potentially lead to very serious health consequences. In Leonard Wachowski's article on hypothyroidism, written for the U.S. National Library of Medicine, he explains how the disease affects the endocrine system. Similarly, in an article by Dr. Stephen Kemp, he describes how hypothyroidism affects the body. Wachowski asserts that the thyroid hormone regulates energy usage in the body. Kemp states that a regulated metabolism, growth, and healthy sexual functioning and development all depend heavily on the pituitary and thyroid gland working together to secrete hormones that send messages to ensure these functions and processes be carried out properly. So when the thyroid isn't working properly, their normal function is interrupted, causing some of the aforementioned symptoms. According to Wachowski, you can be born with hypothyroidism, but if you weren't, it's also crucial that anyone with a family history of the disease be screened. Hypothyroidism is a relatively common and readily treatable disease, but the symptoms can go easily unnoticed. In his article on hypothyroidism, Mario Skuger states that within the U.S. population, the prevalence of hypothyroidism is 4.6%. He goes on to state that a significant portion of those with hypothyroidism do not present symptoms, so those found clinically evident of hypothyroidism is around 0.3%. Women are also 10 times more likely to be diagnosed with hypothyroidism than men. He further concludes that the risk of developing hypothyroidism rises with age, with the elderly, especially elderly women, being the most susceptible. The global prevalence of hypothyroidism, according to Mark Vanderpump, varies greatly by location and gender, with 0.6 to 12 in 1,000 women and 1.3 to 4 in 1,000 men having the disease. Differing iodine levels in regional locations is suspected of contributing to this variance. Other causes for the disease may include Hashimoto's disease, a genetically inherited autoimmune disease where antibodies attack the thyroid and inhibit its proper function, thyroiditis, or inflammation of the thyroid, congenital hypothyroidism, or hypothyroidism that is present at birth, surgical removal of part or all of the thyroid, radiation treatment of the thyroid, and some medicines.